Good morning, everyone. I'm Jess Daly. My son Avery is diagnosed with a KDM5C genetic variant. He is 4 years old, and I adopted him from foster care at 2 years old. So he came to me at 14, 15 months old, failure to thrive, global developmental delay. There was some uncertainty about how much was due to neglect, environmental, physical, emotional, so on and so forth, and if there was an underlying condition. Leading up to his genetic diagnosis, we'd seen a variety of specialists, I would say somewhere around 20 to 30. He wasn't crawling, holding himself up, holding his head up. He was wearing size 3 to 6 months. In terms of growth, Avery's always been in the first percentile. He's not even tracking on the growth chart. He did have a feeding tube as an infant. Birth family removed it. And there was a lot of trying to figure out how much was trauma-based, neglect-based versus how much was an actual medical condition. So I think fortunately for my situation, because he was in foster care, he had to have regular treatment. We had to kind of go on the diagnostic odyssey early. And prior to genetic testing, he had been diagnosed with autism just before he turned 2, cerebral palsy initially, which was later changed to slowly progressive spastic paraplegia. He has hypothyroidism. We have some vision issues with hyperopic astigmatism. Those were the primary diagnoses, hypospadias. And then along the way, we kind of started seeing so many different diagnoses affecting different systems that it didn't make sense that all of these things were happening without some kind of underlying genetic condition. So all of our care is through Vanderbilt Children's Hospital. Some of you on here from there, so thank you for all your love, support, and care. Everyone's amazing. We did have genetic testing done, and ironically, it was the IDEA panel that disclosed the KDM5C variant. And we did testing in October and got the results back in January. So I received the results personally about 4 weeks before adoption. And 2 weeks before adoption, the geneticist called and confirmed. By that point, I had already read everything out there on the internet there is to read about this. And currently, the diagnosis is about 1 in 32 million kids or adults in the world are diagnosed with KDM5C. And it is definitely a spectrum of experience. Boys do tend to be more severely affected because it is an X-linked condition. And that's not to say that girls can't be. Avery has an older half biological sister on mom's side. She's severely affected as well. Some of the other bigger concerns for him, or probably one of the biggest, is epilepsy. So he has not had seizures to date that have been documented, but he is a very high seizure risk. And boys tend to develop like medication-resistant epilepsy. So that's one of the things that I follow closely and is probably like my high alert thing for him, amongst other things, keeping him safe, helping with communication. Avery is non-speaking. He's definitely not nonverbal. He is non-speaking. So at 4 years old, he says no words. He doesn't babble. He doesn't mimic any sounds. And he can communicate probably maybe 3 to 4 signs, but he does have gross motor development issues as well. So he doesn't have the dexterity to actually sign things appropriately. One of the other things that is that KDM5C is characterized by is hypotonia or mixed hypotonia and hypertonia. So that we think that causes some gastrointestinal issues. He does have dysphagia, so a lot of trouble swallowing. And I think ironically, from a personality perspective, he's an extremely happy little boy and he is highly receptive. So he listens, he understands, he follows directions like a typical 4-year-old when he wants to. But on the expressive end, communication is by far our biggest challenge in giving him the tools to communicate. So he uses PECs. He recently got an AAC that we're working on. Developmentally, he's probably somewhere between 18 and 24 months. But of course, that's based on testing that doesn't necessarily take into consideration the inability to speak. Size-wise, he's 24 months T on a good day. And tracking his weight, making sure he's getting enough calories. Eating is very taxing. Like all the muscles required to swallow, that's all very taxing. But like I said, he's a super happy kid. He has a very pleasant disposition. On the flip side of that, he can also be very aggressive and impulsive, both of which are very common characteristics in boys. The short stature, there's some clinical presentation features as far as his face, his hands, some of those things. Those are the more common clinical features that you would see in kids with KDM5C. I do have some experience in the medical field, limited. I'm by far more of an expert in this disease only than anything else. But Avery was born at Vanderbilt. So I immediately knew that if I could stay with Vanderbilt for the duration, I didn't know that he was going to be up for adoption. He came in foster care with his oldest sister. And the adoption happened very quickly, less than a year. So if anybody's familiar with foster care, that's unheard of. But I stayed with Vanderbilt, which gave me access to his medical records from birth, which he did not receive a ton of treatment. So birth family just didn't really do any of the things that were necessary. Now, I do think birth mom is affected, and I think birth mom has been taken advantage of in this situation, and she's undiagnosed. I also think that biological uncle is severely affected. A lot of the things with Avery, and this is just based off conversation because I don't have access to any records or information from them. But Vanderbilt took great care of us, and I essentially read through every medical record that I could get my hands on and followed up with providers, which some of that was required by DCS, and some of it was, okay, he's with me, he's in a safe environment, nurturing, we're eating, how quickly could he be catching up, and what are we missing? Yeah. So initially it was we had to see all the different providers just to follow up on things from birth, like cardiology. He had a hole in his heart. Well, that had healed. Neurology, obviously, for all the different things that we were experiencing. And I did think he was having absent seizures at one point, but we've not been able to capture that on an EEG. And then, of course, his PCP, so local nurse practitioner, she is the only local provider we have. And then we started PTOT. We were on a waiting list for feeding therapy and speech therapy for a little over a year. So those providers were brought into the mix very early. I wasn't even sure that he was going to walk. I mean, I wouldn't say that it was necessarily scary for me because I just didn't know what to expect. But I just kind of treated every little milestone as a celebration. And for me, that was the best way to navigate everything. And I'll say it was overwhelming at times because I do work full time and I had other foster kids at the time. And then we've had several hospitalizations for random things. I mean, he has a weakened immune system, so he was sick all the time. We don't know much about how KDM5C affects the immune system, but we do know that it has some associations with cancers, leukemia, or some other neurological diseases. And then at some point he developed acute ITP while we were out of town at the beach. So when I say it's random, it'll be random serious medical conditions that pop up pretty quickly. And in that particular case, like, it was nearly life-threatening. He was just bleeding from everywhere, and we ended up at the hospital in Jacksonville, but even they were able to coordinate with our providers from Vanderbilt. Over time, some of the providers I was able to, close the follow-up. So we primarily work with a developmental specialist, and she helps coordinate all the care, which is amazing. I do feel like, as a parent of a kiddo with a rare disease, having access to all his medical records and having access to a united care system has made all the difference, because everything is at my fingertips. And I've had all of the providers I've had, I'll say, follow up very quickly on his case. If I send them anything or have questions, it always comes back to me quickly. So, it's when I consider services, I told Terry Jo last night, we actually live in Tullahoma. So it's quite a commute, especially when we were doing physical therapy and occupational therapy 3 or 4 days a week. Like, it's a commute to get to Nashville and back for a 30-minute or hour session. But it's worth it to have the providers linked and everyone able to share and communicate. I think we did receive genetic testing much earlier than other families because he was in foster care. And I think that's been a tremendous advantage for us. He's probably the second or third youngest in the world diagnosed. And I've had an opportunity recently, traveled with 2 families. One family has 5 children, 3 boys, 2 girls, all affected. And they're from Texas. And then another family who has 1 little boy who's severely affected, who's 6, and an older son who's not. I do have an older son who's 16. So this has been a journey for him. Even just transitioning from having, I had probably 14 or 15 foster kids before Avery came along. And then with his adoption, I had to take a break just to kind of get him in a position where he was stable and we knew what was going on. So it was a tremendous adjustment for my son, who legally at the time was my only child. And he has learned a lot through this process, like, about children with special needs. And it's a very different experience, I think, to my advantage, because there's such a significant age gap between the kids. I understand that Avery's on his own timeline, and I don't have the same expectations for him. I don't know what the outlook is. I don't know what epilepsy will look like for him. I don't know what spastic paraplegia will look like for him. I know many kids have had surgery to help with that as they grow, but it can be a little daunting to think too far ahead, right? So I try to rein that in a little bit. But back to your original question, our care providers have slowly dropped in number. We have a handful. I have a handful that I follow up with regularly, and those include, neurology, pulmonology, GI, his developmental care, and then of course we still have all the therapists. And then there's a few others sprinkled in there. Like, we worked with Vanderbilt CHIP clinic when he had ITP. So that one may eventually fall off too, but it hasn't been quite long enough. And I think, I've considered moving other places that have more community-based resources for kids, because that's one of the biggest struggles for me. I just have no resources, and there aren't places, finding. I had someone come in the home for the longest time so that he wasn't exposed to everything out there. But now he goes to preschool and he does 20 to 25 hours of ABA therapy weekly. And that's a lot for a 4-year-old. But it has made a difference in his ability to communicate and how much he's grown and learned over the past year. A lot of kids, the first year or 2, they're seeing their PCP and, following up on things as needed. Now, given he was diagnosed with failure to thrive and a global developmental delay, there were responsibilities on the family that they didn't take care of, and that could have led to an earlier diagnosis. However, DCS requires that you follow up on absolutely everything as a foster parent. So any digging, anything that comes as a follow-up or a suggestion from an appointment must be followed up on within X amount of time. And all of that goes back to, your in-home caseworker and your social worker to show that he's receiving the necessary treatment. Now, in his case, he has a laundry list of diagnoses, and I think we fortunately got linked with the right provider at the developmental clinic who was able to get the genetic testing. Now, I've heard from other families that insurance limitations or people, other providers, like in other parts of the country and other health systems, like they just don't want to do genetic testing too soon. And I don't think you can do it soon enough in these situations. There's a big difference in kids diagnosed at 2 versus 8 or 15. And I will say it's probably not the genetic testing that helped us get so much treatment. It's the autism diagnosis. And he does have he has a lot of autistic tendencies as far as the typical things that you might see with a moderate to severe child with autism. But he could not get services based on the KDM5C diagnosis. It's just too rare. There's not enough known about it. So it's limitations in providers not wanting to dig into that. In fact, I think most of the families did private genetic testing. Like I did a secondary test through Probably Genetic, but it didn't pick up KDM5C because it does I can't remember which type of genetic testing it does, but a lot of families did whole exome and they had to order it in. So they didn't even get to go to the clinic like I did. It was through a mail order company that offered it and they qualified for it. And I will say, like, our geneticist is fantastic, and he followed up. He was able to diagnose his older sister, who's 10 now, and then their oldest sister is unaffected, but I have encouraged her to get testing to see if she's a carrier. But in terms of any additional genetic testing for things, that has been highly discouraged. And for me, that's, as a parent who this has meant so much. So it's been an absolute relief to get an answer for why so many things are kind of haywire with him. I feel like the testing really helps narrow down and support the conditions, and it's nice to know because I'm always on alert looking for things. And the testing helps me form an informed opinion when I go into the doctor's office and I say, hey, I've seen this. Like, I'm not on a wild goose chase trying to say, oh, he's got this because of the testing. And that could be something different between me and other families. So I understand the concern, but I also think there should be more access to it. Yeah, it's been like having an infant for 4 years, and I feel like we're just now transitioning into the toddler. So I wonder, is toddlerhood going to be 4 years?